talk how you've really worked to make Cleveland Clinic the most recognizable healthcare brand in the world at this point?
Well, it's been a great experience, and it starts with the fact that the Cleveland Clinic offers really some of the best healthcare in the country and in the world. And we were recognized in the presidential debate this year by both candidates who both acknowledged the Cleveland Clinic for its clinical excellence. And our mission in marketing and communications is to get that message out. Healthcare is an interesting category. Most people are very comfortable with their local doctor and local hospital, and they're not often thinking about a national healthcare center until they need us. So that's our challenge, is how to connect and engage patients around the country before they get to having to make a major healthcare decision. So that's really what we've been building out our marketing platforms to really accomplish that goal.
So really you want to create that brand awareness now,
right,
so that Cleveland Clinic is in the consideration set down the road should patients need the kind of care that you provide.
Exactly. And we really do it in three ways. We do use paid advertising. We have a very unique advertising campaign in print and digital that focuses on the clinical excellence and unique accomplishments of the Cleveland Clinic. We do the same in digital. We have a campaign in display that really pulls together not just display, but also lots of engaging elements like we call it Healthcare Reframed. It lets you connect to LinkedIn, to search, to videos, and so it's not just passive display advertising. So the whole idea is to get consumers to engage with the Cleveland Clinic brand, find out who we are, and then in the future, if they are facing a difficult diagnosis, for them to consider us as one of their first choices.
I want to get into the specific steps that you're taking with social media and digital, for example, to create that engagement. But taking a step back real quick, can you define the challenge that is marketing a healthcare brand vis-a-vis any other brand out there?
The interesting thing with healthcare, national healthcare brands, most people, the most trusted relationship with any service provider in the country is your local physician and your local hospital. Most people are very satisfied with them for their core medical needs. So awareness is very low. You're not thinking about a hospital like Cleveland Clinic on a day-to-day basis. So we face very low awareness. And then it's a barrier to travel for healthcare. If you're facing a tough healthcare decision like you need a mitral valve repair surgery, the decision to travel and leave your family, leave your support system, leave your home state and travel is a big one. So it tends to be a smaller target audience, a more affluent target audience that we're going after, and very educated. They do their homework, they want the best care, and they make that decision to travel. Our job is to make that decision easier by giving them the best information and really giving them all the tools so they can get to know the Cleveland Clinic before they ever get there.
Got it. Now you were CMO at Delta Airlines before you joined Cleveland Clinic. Talk a little bit about, that was 7 years ago now, but what learnings did you take from that experience in the airline industry into the healthcare arena?
I think that the thing in the travel industry and the airline industry while I was there, the huge transformation that took place was it moved from being a world of offline to completely online. When you think about the airline experience today, the travel experience, you do all of your research online, either on an airline site or a hotel site or a travel site like Expedia or Orbitz. You book your own flight, you check yourself in,
it's very autonomous.
You prepay for your bags, it's all self-service. So we tried to bring that same digital focus to healthcare marketing. And previously it was very lacking in the category. And one of the critical things people need is trusted information. And a lot of hospitals aren't in a position to create the amount of content we create at the Cleveland Clinic. Every piece of information on our website has been vetted or created by our physicians and researchers. So when you see the Cleveland Clinic name on it, you're getting trusted medical information in a world where there's a lot of healthcare information on the web that's not of high quality. And that's what people need when they're making a healthcare decision. If you're trying to decide how to stay well and get fit, or if you're facing a complex neurological disease and you're looking for health information, where do you go? Who provides you with the information on diagnosis and treatment? And we'll take you all the way through to finding a doctor on our website and even a virtual tour of the campus so you'll know what to expect before you get there.
So while a lot of marketers are talking about content marketing and the value there, I mean, you're a classic example of how it really makes sense for you to be a thought leader in the space and
Yes.
actually create your own content.
Exactly. You know, I was talking to our head of digital marketing about this, and a couple of years ago everybody was saying, well, you should be a curator of content. Well, we don't want to curate anybody else's content. What people want from us is Cleveland Clinic medical content, and that's what we bring. And we've increasingly taken that out now in social media. So we're very active on Facebook. We typically post 6 to 8 times a day.
Wow.
We tweet. We have a very active, very highly engaged Twitter following. We have 1,100 videos on YouTube. Our most recent video, which was on patient empathy, was actually created as an in-house training video, but it went viral, has almost 400,000 views. And we've recently created a health hub, which is a first of its kind. It's really a content center on our website for daily topical healthcare content. We have 35 doctors, nutritionists, nurses, and our CEO who regularly create content working with our marketing team. So every day there's a reason to come and engage with us, and hopefully we're talking about the topics that are most relevant to our target audience.
How will the impending healthcare reform affect your marketing strategy, and are you feeling the effects of that now?
Yeah, you know, like everything with healthcare, it's complicated. There's very few things that are simple about the healthcare reform process. The biggest change is going to be a lot more patients are going to come into the healthcare system through the expansion of Medicaid and the creation of healthcare exchanges. So we have to be ready operationally to treat more patients more efficiently at the same quality of care than we've been doing in the past. So we've been gearing up for this. We've created a program at the Cleveland Clinic that's unique in the country called same-day appointments. We believe we're the only ones doing it at the scale we're doing it. You can call any day before noon and get an appointment that same day at a Cleveland Clinic location. And that signals to our market that we're ready and we'll be able to accommodate the needs under healthcare reform. Created a whole campaign around it called The Power of Today, featuring all of our caregivers, physicians, administrators, red coat greeters. So it's a very welcoming spot, but also reminds people the excellence of the Cleveland Clinic is available to you today.